Hospice of the Northwest, from the San Juan Islands to the North Cascades, cares for patients and their loved ones. Compassion and dignity, every moment of life. Compassion.
For both of my parents, their greatest fear was dying away from their home. They wanted to die in their home. And both times that happened because of the presence and the support system that hospice provided. It was very peaceful. It was in the same place, looking out into their gardens, surrounded by people who cared for them.
Dignity.
When hospice came in to help care for my grandparents, it relieved a lot of fear for myself and for my mother as caregivers. We wanted to make sure that they were comfortable and peaceful and dignified. And so to have that support really gave us the confidence to care for my grandparents at the end and took away a lot of the fear.
Compassion and dignity every moment of life.
It is our goal to make every moment of life precious. And I think as you're approaching the end of your life, those moments become even more valuable. If I could tell patients something about hospice, probably the most important thing is to dispel the myth that if you come on hospice, you're going to die quickly. As a matter of fact, the opposite is true.
Hospice of the Northwest applies a team-oriented approach. Medical directors, nurses, social workers, spiritual counselors, bereavement counselors, hospice aides, and hospice volunteers, all skilled in palliative care, providing pain and symptom management, emotional and spiritual support.
We're being called to help people through the end-of-life process. And we are there to help them meet their goals, and we are there to help them be comfortable and to give them the best quality of life they can have. We're not there to hasten death. We're not there to facilitate death. We are there to facilitate life.
I got into medicine to help people feel better and to reduce suffering. I think one of the troubles with talking with patients about prognosis is that physicians worry that they're going to dash someone's hope, but in fact, hospice is all about hope. It's focusing hope on things that patients can achieve and hope for a day of comfort and hope to hit a certain goal, and that's what hospice is really about, is hope.
Hospice is not a place. It is a model of care, quality rather than quantity of life.
I wish patients and families knew that hospice is really more about living, and that our staff are really upbeat and fun, and they'll bring joy to the patient and family.
I think out of every nurse there is, Takara was the perfect fit for my grandfather. She is a smart and young, dynamic nurse. She's got this amazingly sweet smile. He just looked at her and just said, "You're such an angel."
Hospice is for the living. Everyone says hospice is for the dying, you have to be almost passed on, and it couldn't be farther from the truth. Our whole world is that person, and we really try to promote symptom management, quality of life. If I said nothing else about hospice, it's about helping a person enjoy their life however long they've got left.
Hospice of the Northwest care is tailored to each patient's needs and wishes in familiar surroundings, whether a private home, skilled nursing facility, assisted living, or adult family home.
My father definitely did not want to end his days being cared for by strangers, and he wanted to be in the environment he spent most of his life in. We had parties at his bedside, we had music, we served him some of his favorite food, we had oysters, all of his favorite things. Hospice really allows you to take care of your loved ones in a fashion that you would imagine yourself would like to be cared for.
Hospice quality care at the end of life is extended to everyone, regardless of age, race, or diagnosis.
You can benefit from hospice services no matter what has brought you to end of life. It doesn't have to be cancer. It can be any disease or any diagnosis. If you're at end of life, you can benefit from hospice services.
Hospice of the Northwest. Our goal is for you to be as comfortable as possible, spending precious time with your loved ones.
Most of our patients are covered under Medicare, Medicaid, or private insurance. For those that aren't, we have the Hospice of the Northwest Foundation. Nobody's been turned away from hospice for inability to pay.
I think the most amazing thing about hospice is that they provide a comprehensive service that takes care of everything, and they do it whether you're funded or not.
Our donors at Hospice of the Northwest actually raise the level of care for our patients and families. We couldn't do it without them.
I cannot imagine feeling that they didn't have their wish of being home fulfilled, and because of hospice, both of them had a peaceful, dignified end.
And I don't know what is more kind or dignified in the world than helping people through the most fearful thing that there is.
Hospice of the Northwest. Compassion and dignity every moment of life.